COVID-19 changed the world and increased the need for healthcare, effective measures, and HTA evidence to support the use of these measures. And how has COVID-19 affected HTA?
One was it was very complex situation. There was so much uncertainty. Nobody knew about the agent at the start, and these products were being churned out very quickly and being put out under emergency use. Decisions needed to be done very fast. And finally, it is to be admitted there is very limited role of cost-effectiveness analysis or price considerations because this was something like the rule of rescue. It was a supplier's market. You would buy it if it was available at whatever price.
There were three main areas where we used HTA evidence for COVID. One was around vaccination, second around diagnostics, and third around therapeutics. But the point that I wanted to highlight is that a lot of these HTA assessments during COVID were actually much more rapid in nature. So while there were HTA assessments that were guiding decisions, these are all mostly rapid assessments rather than the usual ones that would take 6 to 9 months.
The NECA has established the rapid HTA process for the diagnosis of COVID-19 disease. And the second work, it is kind of living systematic review, update every 3 months or 4 months. We made totally 26 evidence-based recommendations.
Patient groups, they are not located in Taipei or they may be small. They now use social media to advocate their needs. So we reached more patient groups. And the second is the virtual events. So we get to attend more events for patient opinions and experience than we have before the pandemic.
No one knows when a pandemic will hit again, and HTA community needs to be prepared to respond even better. But how?
In the near future, we can help the government to do the policy reviewing. So for those policies implemented in the pandemic, we can do a review to see if they are efficient enough or where they can be improved. We can do the so-called live HTA, so we continuously gather the evidence, those public very fast, and then we can provide our outputs to the decision-making teams in the government.
I think from the Foundation's perspective, we will be looking more and more at the impact of climate change on human health. So one question that comes up for us is how can the interdisciplinary tools of HTA be used to help policymakers understand the data around climate in their geographies and what that means in terms of the sorts of changes they need to make to policies, what sort of new investments they need to make into healthcare infrastructure in order to anticipate the impacts of climate change.
So, and then we develop new methods, competencies, and tools. We need more competency in dynamic modeling. We need more competency in integrated epidemiologic and macroeconomic modeling. We need to standardize and develop HTA methods for traditional medicine, diagnostic tests, medical devices, health system interventions, non-pharmacologic interventions. And these are both the standard and the rapid HTA. We need to be better able to capture outcomes on equity, poverty impact, and impact into the future. We should collect more data on mobility, on risk preferences, and finally, we should actually try to explore regional initiatives and collaboration in response to all of these needs for information to inform the decisions.